There's lots of things that physical therapy can help with postpartum. It's very common for women to deal with ongoing incontinence issues after having a baby. It's common, but it's not normal, and so it's important that we get over the stigma of being able to ask for help with those things. I think it's really critical that women see a physical therapist before returning to sports, especially high impact activities like running or high intense activities like CrossFit, because a lot of times you really need a lot of foundational core stability and core strength to be able to perform without having some other system break down. And so making sure that you've got any sort of diastasis, which is a tearing or a separation of the abdominal wall that's really common during pregnancy, treated and addressed, as well as that you've really got your strength back before you're returning to 100% on those activities is really important. And that's where I think physical therapy can play a big role. The recovery for C-sections versus vaginal deliveries in general are very similar. The big difference is that after a C-section, your abdominal muscles have been cut. So not only did they get stretched out growing that baby, but they also had a incision right through the muscle, which requires a little more time to heal, but also potentially some different scar management. So after having a baby, the physical therapy exam is going to be somewhat generic in terms of looking at your back, your hips, your shoulders, just in general for mobility differences. A lot of times we also focus quite a bit on breathing. So rehab plans are very individualized. So the length of time in therapy is going to depend on what you need. But a lot of times I'll recommend for women that they start out coming once a week for at least 3-4 weeks to really establish a strength program. And a lot of times people are getting stronger really quickly, immediately when they start therapy. But once a therapy program is established, the frequency of visits doesn't have to be nearly as common. A lot of times I'll see women for as much as 6 or even 9 months after they've had a baby, but I might see them once or twice a month. So it's one of those where it's not nearly as big of a time commitment as sometimes people can fear.